And today the topic is somewhat complex in the sense that though I am a physician and today's whatever I talk about today or any other day is not to be considered as medical advice. And today's topic, taking appropriate prescription medication, is complex because all of you are from different parts of the world. And in each country, the healthcare system is different. And there are different ways of managing prescription medications. And in some countries, like I am licensed as a physician in India, some of the problems that I have come across are probably not even relevant to many of you because so much depends on the healthcare system you're a part of. But my goal is to provide you with information so that you can have a better conversation with your healthcare providers about the medications you are taking. And the same things apply to supplements as well. But next month, I'm going to talk about therapeutic supplementation. And some of the things your doctor or pharmacist, depending on which country you're in, can help you with. But the other important thing is a lot of what I'm going to talk about impacts people who are older adults. And maybe some of you are taking care of older adults, either as a part of your profession or could be a loved one. Maybe you're helping your parents or an aunt or someone like that. So it's relevant for everyone. And I know there are quite a few people from India joining in. The problems in India and prescription medications is a completely different kind. And a lot of it is because of the healthcare system that is in use there. It's not a structured system. People don't use EMRs. So it's hard to keep track. But saying that, and my goal is to provide you with some tools today so that you can go through your own medications or the medications of someone you're helping with. And why has this become such a big problem? There are multiple reasons. Because one is, of course, we are living much longer than ever before. And as we get older, we are, at risk for multiple health conditions, and multiple health conditions need multiple, prescription medications. And eventually, what happens is a lot of things become complicated. And I'm a functional medicine doctor and trained as a brain health coach, and I'm a tiny habits coach. The fact is, it's very hard to keep up with everything that happens. But thanks to technology, we have great tools today. And I'm sure in the years to come, we'll have even better tools to manage our medications better to a point, and this is my belief, and I'm sure it'll happen very soon, where we don't have to rely on a human being to tell us that this medication is probably not the right one for you. Now, I know there are some parts of the world, there are EMRs which actually flag things like maybe this is not the right medication because this one interacts with another medication the patient is on. Or in Alberta, where I am, our pharmacist takes a lot of pains in explaining medications. Though she knows I'm a doctor, she will still tell me, Dr. Carr, are you aware that this medication can cause, high potassium or low potassium or this or that? Are you taking a potassium supplement? Why are you taking it? Your potassium levels, I could check your potassium levels on the Netcare, the lab access. So, mm, some of us are very fortunate that we have someone taking care of all that, but that is not the fact for everyone. So my goal is to help you with some tools so that you can have a better conversation with your healthcare provider. And sometimes that healthcare provider may be your pharmacist. So I will start sharing my screen. So as I said, this is key number 6. And for those of you who are joining us new, every time when I send the recording of the webinar, I usually send a link to all the previous webinars. So don't worry if you have missed the first 5, and you can go over all of them again, and today's webinar also, because I know some of you like to review the information later, because I understand it's a lot of information and sometimes it is new information. It is overwhelming. I mean, I read a lot and I know how overwhelming it can get. So uh, now, what is the definition of taking appropriate prescription medications and supplements? This is nothing, I mean, nothing that you don't already know. The right medications or supplements for the right duration, at the right dosage, and in the right combination, so that the potential or actual benefits outweigh the risks. And as I was talking earlier, there is no prescription medication which does not have the potential for any side effects. So obviously, balancing what is right for you and what is good for you versus what could be potentially harmful. And the other important thing to remember is sometimes by themselves, each of these medications may be fine, but when they are in a combination, the problems can be severe. And particularly, all this that I'm going to talk about today applies to older people more, but I would say it applies to everyone equally. It's just that, older people, many of these medications have not even been tested in older people because of, various reasons. So they don't behave the same way. And my point is, always remember, some new symptom comes up, whether it's in you or, someone you're taking care of. First thing I ask my patients, do you think this is because of any prescription medications you started recently or any supplement you started recently? Because sometimes it's like, we don't remember. So how big is the problem? You can see that in this is just Canadian statistics, but I'm sure it is similar in other countries like the US or UK as well. What was really, I was shocked to know that 70% are preventable. So basically, if we have a good system to tell us that, this doesn't need to happen. And another, this thing is 50% of adverse drug events are misdiagnosed at the point of care. And a lot of this, I think, if we have a digital tool which can flag it. Like I always talk about, why should we depend on our human memory? Because maybe, the person at the ER had a really busy day, which is very not uncommon. And they're not thinking of, is this a medication side effect? But the system should sort of, that is my this thing, the system should tell us that maybe this is what is happening. So the other thing is, some of the adverse drug events are repeat events that occur even when an AD is documented in the hospital, but it is not shared with the prescriber or the pharmacies. And also, more importantly, with the patients themselves or their caregivers. Because I think every patient has a right to know why they are on a certain medication and what happens if they don't take the medication versus if they do take, what are the potential side effects? I'm going to share what the questions are that you should be asking your healthcare provider. So what are the risks of inappropriate prescription medications? Some of the most important significant ones are falls, cognitive impairment, drug and disease, drug and drug interaction, drug and supplement interaction. Drug and supplement interaction is not as big, but falls in older people is very serious. Fall in anyone is serious, particularly if you have a head trauma as a result of the fall. You know that head trauma increases our risks for dementia down the line. So fall at any point because your blood pressure dropped dramatically because of some new medication, or there was some electrolyte imbalance or so many other problems. So that is very important to remember, that why are we talking about these things and how significant they are. And patients may be prescribed medications that are unlikely to help, potentially harmful, or misaligned with the person's health goals. My mother-in-law passed away at the age of 94. When she was about 92, she lived a good life and she didn't suffer at the end of it. She was in Mumbai and she had to be admitted to the hospital because she had pneumonia. And so this is another thing to remember. In older people, acute infections can sometimes cause sudden change in their cognition, So my husband calls up and says, I think our mother's got, dementia. I said, no, no, dementia doesn't happen overnight. Like she was not, sometimes she would doze off and sometimes she wouldn't recognize people, but she was not like, she was not that badly off that suddenly overnight she's like, she can't recognize people. And I said, no, this is very likely an infection. And anyway, it was pneumonia. She went to the hospital. At 92, some doctor prescribed her a medicine called Aricept, which is used in Alzheimer's, but it's not a curative medicine. So I said, I'm going to review her medication list and I'm going to talk to her cardiologist and her, to find out why does she need to be on these medications. Aricept for a 92-year-old woman, like it has no role. So I said, she doesn't have to have this. Then someone added a statin medication. I said, no, she doesn't need that. A third medication was, because her uric acid was high. She never had gout. I said, this is ridiculous. She's like, she doesn't need all these medications. And then the other part is for quite a few months, she decided not to have any medications. She would just spit them out. And I told my, relatives, they said, don't force her. Don't try to get her to do something that she is at that point, she was 92. She's 92 and she doesn't want to take a medication. And the coincidentally, nothing much really deteriorated. She didn't get worse. Her shortness of breath didn't get worse. Nothing really changed dramatically because she did not take those medications. And that made me wonder, what happens if we don't prescribe a whole lot of medications to older people? Again, this is not medical advice. You need to talk to your healthcare provider. But her cardiologist and I, both of us said, so does it mean that she doesn't need a whole lot of these? So then there is a term called polypharmacy, which means using 5 or more drugs, which creates a burden. This is very significant for people who have to take care of older people. Go to the pharmacy. Find out if your pharmacy can deliver at home. Then, the other thing is a lot of pharmacies are very diligent about when you need your refills. So do you have like an automated system? Sometime back, we had a patient here. He said, oh, I stopped my blood pressure medications. I said, why did you stop them? Your blood pressure was very well controlled with the medicines. Oh, I ran out and I couldn't get an appointment with the doctor. I said, do you know that your pharmacist can give you a refill for a short time until you get an appointment with your doctor? He said, oh, I didn't know that. I said, no, from now on, you're going to, put in a reminder on your calendar if your pharmacy doesn't have that system. But many pharmacies have a system where they will remind you that you are going to run out of your medications very soon. But if the pharmacist doesn't have the system in place, I would suggest that is something you can do for yourself. And if it's a medication, like blood pressure medications are not something you're going to take for a short time, unless it's a new medication that's been added and your doctor needs to see whether you have any side effects. That is different. But if it's a medication you've been taking for a while and there are no side effects and your blood pressure is well controlled with that, definitely it's your responsibility to make sure that you have adequate refills because you don't want to be not on a medication that has worked well for you. So polypharmacy doesn't necessarily mean it's bad because, and I realize I am on more than 5 prescription medications. I take 2 blood pressure medications. I am on hormone therapy. I take thyroid medications. So polypharmacy is not necessarily always inappropriate, but as the number of medications go up, the chances of interaction, cross reaction, side effects go higher. So this is something to keep in mind. And so this is again something very important. You can just do an internet search. You will find if there are any geriatricians in the audience today, they use this. So the Beers criteria, this is by the American Geriatric Society, and the Stop Start, this is in the UK. So there are certain medications which are not to be given to older people, and there are a whole lot of criteria. So most of the time, you can talk to your pharmacist to ask about this in case your doctors don't always have time to go over all of these in details. And doctors, if they are not geriatricians or they don't take care of a lot of older people, may not even be aware that a medication could be causing a problem. So this, and the other important thing is, all doctors, let's say a patient goes to multiple specialists and all the medications are not recorded in the same place, but you as the user or the one who takes care of someone, you know which medications are those. So it's also, I would say, yes, it is the responsibility of the healthcare provider, but eventually it is, the person who's going through that experience who is affected the most. So I would say it's very important for you to know what the medications are and what are they doing for you. Now, this is the deprescribingnetwork.ca is a very important website. I would suggest that you go over it. It has a lot of useful information on what, for patients particularly, and I know many people in our audience are doctors as well, for doctors as well. So it's for doctors and patients, a very good website. So first of all, go over your medications and ask these questions. Why am I taking this medication? Now, sometimes, it's not so much, I've not seen this so much in Canada, but I know many patients in India are afraid to ask the doctor, why am I on this medication? Versus here, whenever we have a conversation, when patients have a conversation with their doctors, they are usually told that this is a medication I'm giving you for your blood pressure, this is for your diabetes, this is for your cholesterol. But it's not the same in every country. I know in India, it's like recently I was helping my brother-in-law with his medications, and his diabetes doctor gave him one medication which I know was for his, he has some essential tremor, so his hands shake a little bit. He is retired, he's not doing any fine work, so it doesn't actually impact his day-to-day life as much. So when I asked him, I said, what did your doctor say? Why did he put you on this medication? He said, oh, that's the diabetes doctor. So this is for diabetes. I said, no, that medication is not for diabetes. So this is the kind of conversations, I know it is the responsibility of the healthcare provider to give you all the information, but what can we do if it doesn't happen? So we, as we have to advocate for ourselves. There is no other way that I can see. And why should we advocate for ourselves? Because we are the ones who are going to suffer. So what are the potential benefits and harms of this medication? Can it affect my memory or cause me to fall? Can I stop or reduce the dosage of this medication? Who do I follow up with and when? So when I send the recording of this webinar, I'll send, so I tried to create like an Excel spreadsheet to help my patients, manage their medications better. But you're free to use that Excel spreadsheet. I didn't find it very easy because the columns were like big and they go into and if you're opening it I have not tried opening it on my phone. Even on a laptop, it like kind of, I have to scroll across. So I'm still trying to find a right tool. And I've talked to a few techies. I said, if you can create something like this even on a website, doesn't have to be an app. This can definitely be very helpful. So if you can make it into a table from an Excel spreadsheet, I tried that too, but it was becoming too big. So I have to figure out a way on how to manage that better. But I will share the link to that Excel spreadsheet, and it has a few, it has links to a few websites, which I'll talk about. So this is very important. This is by the Deprescribing Network in Canada. They said these are the questions you need to ask your, doctor or your pharmacist. And when I look at prescription medications and supplements as well, these are a few things that I like to ask. One is drug-induced nutrient depletion. Now, this is not something that your pharmacist or your doctor would usually think about, but we know that certain prescription medications, for example, statin medications, the medications used for lowering cholesterol, they cause depletion of B vitamins. They cause depletion of CoQ10. Now, CoQ10 is not a test you would routinely do. That's a specialized testing. I don't even recommend it for my patients because the testing is quite expensive. But CoQ10 can be supplemented even if you don't know your CoQ10 levels, because CoQ10 it's something that our bodies are naturally supposed to produce, and with age, with medications like beta blockers and statin medications, your levels would be lower. So taking and CoQ10 also helps improve blood pressure. So CoQ10, you can, again, not medical advice. I would recommend a CoQ10 supplement for my patients even without knowing their levels. So drug-induced nutrient depletion, metformin is another extremely common medication which causes depletions of B vitamins, particularly B12, magnesium. Magnesium deficiency is caused by a whole bunch of other conditions. So what I suggest is best way to do, as far as I know today, there are some websites which look at drug-induced nutrient depletion, but it's probably easier to just do an internet search. And depending on which tool you're using, there are a lot of, AI tools. Like one that I've recently started using is called Perplexity AI. And I find that the good thing is they also provide the references. So asking a tool like Perplexity AI, does my XYZ, whatever medication, cause any nutrient depletions? Please add the references as well. So yes, it takes time. And sometimes if it's a newer medication, they don't have any information on that. Like things like birth control pills cause B vitamin depletions. So that is important to keep in mind. And sometimes, like I said, we don't even need to test for all the minerals. Like magnesium, I have talked about it before. Your blood test, serum magnesium is not going to tell you how much magnesium you need. Next month, I will talk about magnesium as a supplement. It's one of my favorite supplements. And fortunately, it doesn't cost a whole lot. So that is one supplement I recommend to all my patients. Next is drug-drug interaction. And again, here I would suggest there is one tool that I use. I'll share that with you all. It's on Medscape. Medscape drug-drug interaction. Drug supplement interaction is also a similar one. The other thing is, are these new symptoms explained by new meds or new supplements? And does the medication affect cognition? And does it affect body weight? So there are medications which affect cognition, and that is in the Beers criteria and the start stop, those are there. And affect weight is also very important because a lot of my patients are trying to lose weight. So some of the antidepressants, SSRIs, and antipsychotic medications. And it doesn't mean you suddenly stop these medications cold turkey. I'll come to what you should do. So the fact is there are a lot of things. And for my patients, I usually ask them to do the homework, and my patients are really wonderful. They do the homework themselves. I said, okay, check this, send me the screenshot because sometimes you can't export that data. Or let me know on an email what are the medications what are the depletions you found these cause. Drug-drug interaction, if I'm prescribing the medication, I usually check, but I don't prescribe a whole lot of prescription medications because they already come to me they are already on those medications. Drug supplement interaction, I definitely check, particularly if they have a lot of health challenges. And of course, the other things as well. So most important to remember is this a side effect of a medication or a supplement? This is not so simple and easy. I know of someone who went through a upper GI endoscopy, colonoscopy, and everything because this person was having GI symptoms, and eventually it turned out to be the GI symptoms were from metformin. Now, metformin can cause gastrointestinal symptoms, bloating, diarrhea, and all that. So instead of the doctor looking at the medications, which was a simpler fix, the patient went through all these, expensive investigations only to find out there was nothing wrong. It was just the medication which caused the problem. So this is, I know, I mean, a lot of it is overwhelming. Like, how many things are we going to keep track of? But, eventually it's our health which gets affected. So one is, are there medications you should not be taking? I gave you the long list. Do they affect cognition? Do they affect this? Do they affect your body weight? But are there also medications that you should be taking, but you're not taking? And I find this because I'm so focused on hypertension and better blood pressure management. There are people who'll say, oh, my doctor has actually given me a blood pressure medication, but I decided I don't need it because my blood pressure was high at that point because I was very stressed. Now I think it's okay. I said, have you measured your blood pressure? No, I've not measured, but I don't feel any symptoms. So, no, hypertension doesn't always show any symptoms. So, are there medications your doctor has prescribed and you've run out of, or you decided they're no longer relevant? Because conditions like hypertension, diabetes, heart disease, these require long-term medications. Things like Parkinson's, all of them require long-term medications. And next month, when I talk about supplements, I'll also say how long do you need to take certain supplements. So one is important to know, are you not taking something that you should be taking? And in that list, I'm including a bunch of them. One of the most important things, all of you know, I talk about hormone therapy in women and men as well. And unfortunately, many women are being, scared are being told by their doctors and other healthcare practitioners, hormone therapy is going to kill you. That is not true. And today I won't have time to go over it. I've talked about that on other webinars. So in women, hormone therapy, that means estrogen as a cream or a patch on the skin, and oral micronized progesterone are both bioidentical and they are definitely safe for most women. The only women who cannot take hormone therapy are women who have some hormone dependent cancer like breast cancer, endometrial cancer, some lung cancers. So the number of women who don't qualify for hormone therapy are less. Taking hormone therapy because you have a family history of heart disease is not going to kill you. On the contrary, not taking it has a lot of serious consequences. And like I said, I can keep on talking about hormones. I have personally been on hormone therapy for a long time. And like I told my husband, I said, if you want to kill me, just take away my hormones. You won't be able to live with me. And that is not just me, it's a lot of us who think that way. Without hormones, we are not easy to live with. Men and testosterone therapy. That is again a very important area to look at, because testosterone in men is not just, being whenever we use the term testosterone, a lot of people think it's only about sexual performance and libido. No, testosterone in men is very important for metabolic health, diabetes management, mood issues, bone health. Mood and bone in men are not things we usually talk about, but they are very, very important as well. It's like, oh, bone health, it's always about postmenopausal women. No, men have problems with, thinning bones as well as they get older. And I'm not saying that testosterone in men is going to solve all the problems. No, but testosterone, along with all the numerous changes that I've been talking about, lifestyle changes, taking the right medications, all those things matter. Now, SGLT2 inhibitors in type 2 diabetes, this is very important, particularly for South Asians, because South Asians, that is people from India, Pakistan, Bangladesh, Sri Lanka, are more are at a higher risk for early heart disease and stroke, premature cardiovascular disease, and their diabetes progresses much faster. So SGLT2 inhibitors are medications like dapagliflozin, canagliflozin, empagliflozin. Those have shown in studies, they have shown benefits for kidney and heart. And as all of you know, diabetes affects the brain, heart, kidney, your blood vessels, nerves, every system in the body is affected by poorly managed diabetes. I won't say it's just because you have diabetes, you'll have all these problems. If your blood glucose levels are maintained well within a very tight range, you will not have these problems. And kidney disease is very serious, and particularly South Asians, they have deteriorating kidney function much earlier because there isn't a lot of treatment for kidney disease. Eventually, many people end up needing a transplant. And after transplant, as many of you probably know, life is not easy. So are you taking an SGLT2 inhibitor if you have diabetes? Obviously, you need to talk to your doctor. A few days or few weeks ago, the new recommendation guidelines for management of diabetes by the American Diabetes Association came out. And if you are interested, you can go over it, or you can ask one of the newer, GPT tools to summarize it for you, which is what I realized. I found that and I'm like super happy. I don't have to read the whole article. But the important part is to go and verify whether what is being said is actually true. But it has made my job easier. So SGLT2 along with metformin can be started right at the beginning of managing your diabetes if you are on medications. Obviously, this is a question, this is something you need to ask your doctor. This is not medical advice from me, but I have seen a lot of prescriptions. Like I said, my medical practice is from India, where people have had diabetes for many years, but they are not on an SGLT2 inhibitor. And so that is something important. You need to ask your doctor. And again, all the caveats, because some doctors are not happy when patients ask them questions. They'll say, are you the doctor or am I the doctor? So I usually tell my patients, I said, how's your doctor? Is he open to like you asking anything? And sometimes they'll say, yes, he is. Sometimes they'll say, oh, he has no idea of new food and lifestyle and any of that. But this is, of course, not food. This is prescription medications about which he should know. The next thing is these two are very important. Is your blood pressure at the target? Like I'll tell you, this is anecdotal, but I'm always afraid when someone tells me my blood pressure is fine. I said, what is your definition of fine? 140 by 90. I said, that is not fine. No, my doctor says it's okay. My blood pressure was high that day when I rushed to the clinic. I couldn't find a parking and all this. I said, no, 140/90 is not okay. So most importantly, if you have hypertension and you are on a medication, but your blood pressure is not on target, it is as bad as not taking the medication. So yes, your doctor is supposed to be diligent about your blood pressure. And this is the problem with hypertension. This is something called clinician inertia. And it's not just with hypertension, it's with diabetes as well. That the doctor doesn't, escalate the treatment when they find that patients are not a target. Because sometimes they'll say, oh, that means adding a new medication. Maybe for diabetes, it might mean adding insulin, and they don't want to add insulin because the patient doesn't want it, or the doctor feels that, oh, I should not add more and more medications. But that is not right. So we need to have a conversation with the patient. So remember that is your blood pressure on target. So whenever any of my patients tell me, no, doctor, my blood pressure is fine, I said, I need to see your your numbers. And most of the time, their blood pressure is not, if they are, some of my patients are very diligent. They measure their blood pressure morning, afternoon, night I ask them for a week. Sometimes they do it for 5 or 6 days. But most of the time, those readings are enough to tell us that their blood pressure is not on target. There are more readings in the, yellows and reds versus in the green. So that is important. Next is again the same thing with your blood glucose, your diabetes, if you have diabetes. If you don't have diabetes, even more important that your blood glucose should be in a very tight range. I have talked a lot about blood glucose and blood pressure on earlier webinars. So I'm not going over that. But yes, it is, it's your healthcare provider's responsibility, no doubt about that. But we are the ones who are going to be affected by it the most. So I think, again, we need to advocate for ourselves and we need to be diligent and know, and not just leave it, oh, my doctor knows best. So that is important. Now, what I wanted to highlight here is, let us say you've gone over your medications and you feel that maybe I don't need so many medications. What should you do? Now, don't stop any medication cold turkey, because some of the medications need a very structured way of deprescribing. Deprescribing meaning either reducing or stopping the medication. So few areas where I see a lot of challenges is, one is, psychiatric medications. Never, never, never stop them cold turkey. And there is a very structured method of deprescribing. So this particular website and the one I mentioned before, deprescribingnetwork.ca, both of those have deprescribing guidelines, and not every doctor is trained in deprescribing. See, most of us doctors are used to adding more medications. We don't always know how to reduce them. But this is important to keep in mind that, don't stop your medications cold turkey. There is a very specific system, not for every medication. Some medications you can stop cold turkey, but not all of them. And so First is to figure out which medications you need to be on them. Like a patient described to me, doctor, tell me which are the mission critical supplements. So which are the mission critical supplements and which are the mission critical prescription medications as well. Then comes how long should you be on them? And is there a way, because sometimes some medications, if they're not doing anything for you, talk to your doctor whether you need to be on them or it's okay to get off of them and see how you feel. And same thing I tell about supplements to my patients. Doctor, how long do I need to be on it? So some supplements, if particularly herbs, not supplements so much, I'll tell them stop it for a few days and see how you feel. If you don't feel any difference, maybe it's okay not to take that any longer. But some, of course, you won't feel any difference. Like omega-3 fatty acids, magnesium, you're not going to experience any symptoms right away. And those are supplements, those are not herbs. Next month, I'm going to talk about the differences between the two. Some of you already know that. I have talked about it before. So deprescribing medications, again, do not venture into this by yourself. And for my colleagues in India, I would say stop being your own doctor. Please go to a doctor. So in Canada, a doctor cannot be his or her own doctor. They can't even treat their family. And I'm sure it's similar in the UK and the US. But in India, a lot of doctors, regardless of which specialty they are their own doctors. And I usually warn them, like, just because you are a, gynecologist, you don't know enough about internal medicine. You don't really know how to treat hypertension. So stop being your own doctor or diabetes for that matter. So these are the things that I usually, I talk about is what are you taking and all those questions about why and how long and what is the appropriate dosage. Are you on the right dosage? Are you on a dosage which is too low? What are you not taking? I gave you the list. And the next part comes the deprescribing. So in geriatrics, they actually have a deprescribing appointment every, I think they have every 6 months or so, where they review your medications. But even if you don't have such an appointment, I would suggest you as a patient need to know why are you on this medication and how long do you have to be on it, and are you in the right dosage? And and of course the whole long list of stuff I talked about, the drug interaction and nutrient depletion and drug supplement interactions. All those things are very important to keep in mind. I think that was my last slide. So now, as always, it's open to questions. And I know this is a lot of new information probably for some of you. And you will receive a recording, and you will receive a recording of the previous webinars as well. And next month, I'm going to talk about therapeutic supplementation, taking supplements at therapeutic dosage. Oh, I talked for like almost 40 minutes, and we're going to finish early today. I'm happy. If you'd like to ask a question, I'm going to stop the recording now. You can raise your hand and I can unmute you.